tell us a little bit about your how you use toxin testing, how you use this more detailed testing about your body's reaction to it. What's your experience with toxins and the brain?
Yeah, and this is more of, multiple layers deep for the most complicated cases. But when we really look at this, right, there's a lot of people who are doing urine testing, but that's more of like exposure testing. So that'd be like saying, hey, we were all in a room with someone who had the flu, we were all exposed. And it's just like, but what I want to know is who couldn't mount the proper immune response, right? Who had an altered immune response? Because that's the person who's going to be sick. That's the person who's going to be impacted. And we're seeing that a lot now with foods and insulin responses. Like we can all eat a banana, and every single one of us is going to have a different insulin and blood sugar response. Some of us will
Mhm.
be completely fine. Some people will be like, "Oh my gosh, that's the worst thing for them." And so that's
Mhm.
really what these antibody tests are for, is to say, hey, when you get exposed to this, your immune system goes crazy.
Mhm.
Versus trying to have an arbitrary line that basically says, because I get lots of people who've done so much urine testing for environmental toxins and actually stopped doing them because every single person had plastics, petroleum, pesticides, herbicides. And I'm just like, everyone's got the same thing, you know? Why am I really doing this? It's more of what's happening in their immune system. Because if they have an immune response to it, like the person with a peanut allergy, you're not like, how many peanuts can we give them? You're just like, no, any exposure is bad. That's going to be a bad immune response and a bad outcome.
It sounds like you're saying what matters is this person's body having to go into overdrive with the inflammation and make all these pain-inducing chemicals, cytokines and interleukins to try to fix this problem. And of course, those are the chemicals that travel to the brain, well, to the trigeminal nerve, which is a nerve outside the brain that goes into the head and trigger those nerve fires. And that's one of the, that's the mechanism by which many migraines are generated. But I get that perspective, like it's how your body's reacting to it, that inflammation piece. But I'm just curious what your experience is with some newer therapies. So in your book, one of the things you talked about was transcranial magnetic stimulation. And just so everybody knows, that's basically a magnetic field, okay? And there are big ones that people keep in their offices, and then there are little ones that you can buy for migraine. So a device called Savvy Dual, S-A-V-I, Dual like two, is FDA approved for migraine. So we can all go get one. We do have to have a doctor's prescription, but it's a device. We can buy it. We can use it in our home. I'm just curious how you feel about TMS and brain things in general or migraine in particular.
Yeah, so TMS has a ton of research when you look at the brain, from depression to anxiety to insomnia to restless leg to stroke to dementia, like Parkinson's. Like it's probably one of the most researched non-pharmacological treatments out there. I really do like it for depression and anxiety. I don't use it, in general for migraines. I find other things to be more predictable, but ultimately when you look at TMS, it's about trying to get the firing pattern in the brain back to normal. There are certain parts of the brain that may be overfiring, and so you set it up in a way to basically chill it out. And then there's other parts that are underfiring, and you'll change the way it's being delivered to make it connect better. And then when you look at some of the depression research, TMS, which ultimately it's brain stimulation, but one of the reasons why it works, they looked at inflammatory cytokines like interleukin 6, and they found it went down after doing TMS therapy.
IL-6 is one of the genes that's associated with migraine abnormalities in IL-6 production. It's an interleukin. It's a, just for everybody who doesn't know that one, it's a chemical that's made by the immune system as part of what we call inflammation. And that's one of the magic 180 so far. Interesting that that's what they found to be decreased. That could be part of the reason it works for migraine too.
Correct. It could be part of the reason. And I tell people, it's just it's one of the tools. Always try to go deeper and say, why do we believe this is going to work? And
Yeah.
that's where, a lot of this stuff is frustrating for me because we still try to go a lot more generic than I think we should.
Oh my gosh, I so agree with you. And I think that's one of the biggest problems with mainstream medicine approach to migraine. We treat it all as migraine disease like it's one disease. It isn't. Even if you just look at the genetics, it's not. It's at least half a dozen different things that are going on in people's bodies that result in this symptom of migraine. And yet we have put a label on it, we've given it diagnostic criteria. And when we try something, we take all comers who fit these criteria and say, okay, we're going to give you this and see if it works. Well, if you're one of the people who has more neuronal problems, sure, if it targets neurons, it might work. If you're one of these people who has more inflammatory problems, probably not going to work for you. And so I think that you're absolutely spot on with that. I totally agree with you that it's about figuring out what's going on under the surface. You have to pull back the hood. You can't just say, oh, I have migraine. That's what's wrong with me. That is not the end of the story. You have to figure out why you are having that symptom, not just do everything you can to suppress the pain. Yeah. Yeah. I think that's a big thing. Interesting. So another technology that people ask about a lot is neurofeedback because it sounds so cool, right? You map your brain and you figure out what's working and what's not, and then you put this thing on your head and make it all work just right. But I don't know. I feel like I feel like the promise is more than what it can deliver usually, at least when it comes to migraine. So I wanted to see what your experience is with neurofeedback in general.
Yes, I'll use it from both a to look at your brainwave perspective, which can be beneficial, but even then, I still rank it lower down on my diagnostics. Like I will take your eye movements any day of the week over your QEEG brain map any day.
Interesting.
Okay.
Interesting, because so many people want to have, their QEEG
Mhm.
done. It looks so cool when you see the things on your Facebook feed.
People love it. People love it. They'll spend money on it. I'm like, yeah, but is that beta dysfunction because of your insomnia? Is that due to your gut inflammation? Is that due to your thyroid issue? Is that due to your blood sugar? Is that due to like there's so many different things that can cause it to be off. And so I don't rank it that high, even though it's something I still like using, but it's once again, it's much lower down. And then as far as treatment, I don't really do a lot of neurofeedback. If I do it on anyone, I do it on kids, typically with ADHD, anxiety, and things like that. But I try to stay with the research as much as I can. And whenever we really look at the research, TMS has exponentially more research on it than neurofeedback. It's not even close.
Yeah, thanks for sharing that. I think it's just as important to tell people what we have found to be effective as it is to say what we have found to be ineffective. And the last time I looked at the data on neurofeedback, and this was a minute ago, this was probably a couple years ago, I'll be honest, it may have changed since then, but they did this technique where, they put the electrodes on they're trying to deliver a stimulation and train a part of your brain to fire better as a result of the stimulation you give it. And it all depends on this special algorithm between what the electrodes are picking up and what it delivers back to your brain. So they did this interesting experiment where they use like the protocol, and I'm sure there are several, there must be ones that are better, but in this study, they did the protocol versus just a sham protocol. It was completely random. The feedback you got was completely random, had nothing to do with how your brain was firing or anything it was doing. And people got the same results, same results. So it had nothing to do with any kind of stimulation coming back to the brain. And I looked at that and said, well, they were all just meditating. And there's volumes of of research to show that meditation or even just chilling for half an hour is good for you, you know? So I was like, I think that the benefit they were getting was just from the chill session, which, you can do at home for free, let's be honest. So yeah,
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 I mean, a lot of the feedback is really meant to teach you to be present. Like, hey, if you are present, your brain waves are going to be where it should be. And so you're going to get your audio stimulation or you're going to get your visual feedback to let you know because it's where you want to be. So, yeah.
yeah, yeah, good point. It's teaching presence. I love that. If anybody would like to work with you or learn more about your work, what should they do?
Yeah. So if you'd like to work with me, it's really best just to visit my website, peakbrainandbody.com, or to just learn more. Pretty much any social media, it's at Dr. Spencer Zimmerman. I've got lots of in-depth videos on YouTube and all sorts of other places.
Awesome. All right. Well, thank you so much for taking the time to speak with us this evening, for sharing your wisdom, your insights about brain resilience. It is much appreciated.
Yeah, thanks for having me.
Thanks, Dr. Z.
Yep, you're welcome.